First of all, it's not controversial that there is an iceberg ahead in terms of the projected costs of the Social Security system as it now stands and the health care system as it's now operating. Everyone who projects those costs comes to the conclusion that this is not acceptable. It's not going to fit into our GDP. So what to do about it? Well, of course, there are certain demographic developments that are there, and they're going to be in place no matter what. There are a lot more people who are older. The proportions are changing. And so there is a kind of a bow wave there that is inevitable.
Let me just talk about just a few things that George began to talk about. One thing George mentioned is all the economic problems that we are going to face with our entitlement programs, with health care and Social Security. They sure would be easier if there was more GDP to divide up. These programs just divide up what we produce, and as I think George likes to put it, division is a hard problem, but it's a lot easier if there's a lot to divide. And so we kind of looked at some of the circumstances we face. One thing we have become aware of, I think a lot of us have been thinking about this, is kind of the demography that's going on. And people are living a lot longer. Relative to people at retirement ages, let's say 65, today they're living 3 or 4 years longer than they did in 1965, maybe 10 years longer than they did in 1940. So one of the kind of things is to try to figure out how people should allocate all these extra years between work and retirement. And what happened in the 20th century, the whole 20th century, at least for men, all of the extra life was allocated to retirement. On average, there was no longer work. The average length of retirement in 1900 was 2 years. And it's almost 20 by 2000, the year 2000. And we don't think that trend can absolutely continue.
So we said, since that means there's going to be a big slice taken out of the economic pie, the first thing you should do in getting at the problem is to do everything possible to get the pie to be as big as you can get it. Then it's easier to manage the slice, because it's obvious that there is an intergenerational tension underlying all of this. The bigger the pie is, the better you're able to manage it. So we started digging in, and it was surprising to me how many things you can identify in the structure of the Social Security and the health care system that are disincentives for people to work, or failure of incentives to get them to work.
Then we looked at, are there laws and rules and so forth that discourage work? There are actually quite a few of them. One of them is that only 35 years of your work count towards the benefits that you get with Social Security. And we looked at the most common age that men in particular hit 35 years of covered employment. It's 52. After 52, they can keep working, but maybe they don't get any extra benefits for keep working and paying taxes. So we thought that was a pretty young age to say, okay, further work, no more accumulation in taxes. Then we started looking at Medicare. And it's actually not well known that the way Medicare works is you get it at age 65 if you don't work. But if you work with an employer that has a health care plan, the government says, you don't need Medicare, your employer can take it. We thought both of these policies were misguided. We advocate a policy where you get Medicare if you've earned it, whether you work or not.
We've looked at the history of how our system evolved. It's kind of evolved like a two-legged stool. One leg are people who provide services, doctors, nurses, hospitals, insurance companies. They're there, they provide services. And the other leg is who provides money. And that's the government and, at least at first glance, employers. And the consumer leg has really not been there very much until recently. And it's starting to grow, and we have a number of recommendations. I won't go through them because they're in the book. But in general, what we're driving at is to build the consumer leg in a stronger way. In general, you can say that our society has decided that spending on health care is somewhat special, and we prefer it, so to speak, over spending on other kinds of things.
This is a bipartisan problem. This is not a partisan problem. Two presidents, actually more, have looked at this problem. They see exactly the same thing. They actually both wanted to get something done. They failed to get anything done. And actually, I think it's one of the big failures of the last two administrations. This team, we favor, first of all, solving it. We think Social Security needs indexing of more than one sort. It needs indexing perhaps for living longer. It needs to change the way benefits are indexed for inflation. But there are solutions that don't involve cutting benefits from their current levels, don't involve raising taxes, and don't involve individual accounts.